HMPV in the spotlight, what Americans need to know about the anonymous virus. Good evening, folks. Let's talk about something that's been making waves across the globe, news of a virus spreading in China. Videos of overcrowded hospitals have been going viral, raising concerns about whether we're facing another COVID-like situation. This time, the virus in question is called HMPV, or human metapneumovirus. But before we hit the panic button, let's break this down. What is this virus? How dangerous is it? And more importantly, what does this mean for us here in the US and the rest of the world? What is HMPV? Let's start with the basic. HMPV isn't a new virus. It was discovered way back in 2001 by scientists in the Netherlands, and it's believed to have been circulating among humans for over 200 years after jumping from birds. Sounds a little like the origin story of many viruses, right? But here's the thing. It's been here for decades, quietly infecting people without making headlines. In fact, by the time a child in the US turns 5, chances are they've already had an HMPV infection at least once. Most people mistake it for the common cold or flu. Symptoms include fever, coughing, nasal congestion, and mild breathing issues. And for most healthy people, it's no big deal. It resolves on its own in about a week. But, like with any virus, it can get serious for certain groups: infants under 6 months, the elderly, and those with compromised immune systems. These are the people who might experience complications like pneumonia. It's not unlike RSV, another respiratory virus we've dealt with for years. What's happening in China? So why is HMPV grabbing global attention now? Over in China, there's been a spike in respiratory illnesses this winter, including HMPV. Reports from cities like Beijing and Guangdong show hospitals crowded with flu-like cases. But here's something important to note. Experts say this spike is seasonal. It's also being linked to what's called an immunological deficit. During China's strict zero-COVID lockdowns, people weren't exposed to many everyday viruses, which weakened their natural immunity over time. Now that restrictions have been lifted, the population is catching up, facing higher rates of respiratory infections. The good news? Chinese health officials and the World Health Organization, WHO, have confirmed that the spread of HMPV this year is less severe than last year's flu season. And even more reassuring, the virus hasn't mutated into anything more dangerous. It's behaving just like it always has, a seasonal virus that comes and goes. Does this mean a new pandemic? No. Let me say that again. No, this is not the next pandemic. HMPV is nowhere near as deadly or disruptive as COVID-19. To put things into perspective, COVID-19 had a global mortality rate of about 0.28%, leading to over 6.9 million deaths worldwide. HMPV, on the other hand, has a mortality rate much closer to that of the seasonal flu. A study in The Lancet estimated that in 2018, HMPV caused around 16,100 deaths globally, with most of those occurring in infants under 6 months old. That's tragic, of course, but it's not on the scale of a global crisis like COVID. Here in the US, we've likely been dealing with HMPV for years without it ever being on our radar. It's one of the many viruses that circulate during the winter months. And because most of us have already been exposed to it, we've built up some level of immunity over time. So while reinfections can happen, they're usually mild for healthy individuals.
Pneumonia. We've seen a spike, at least in several of the countries, including China, especially in the northern parts of China, a large number of cases of this. And this is very common because what happens is in the colder weather, colder climates, people come indoors and it's much easier to spread the disease, like through coughing and sneezing and touching objects that have been infected from people wiping their nose or their mouth. Well, what we want to know about it is that, this has been around since the early 2000s, or at least we've known about it, right? And it probably existed in the 1950s as well through this time. What we do know is that it generally produces a mild disease and occurs at the same time like influenza virus, respiratory viruses like RSV as well. So it's very hard to distinguish between those three without actually having a medical test. And for the most part, it is mild in people. There is no real treatment. There is no vaccine for this other than supportive care. So anyone having difficulty breathing should definitely see their doctor. In terms of prevention, good hand washing again, staying home if you're sick. If you have symptoms of coughing and sneezing, making sure that you're covering that, or wearing a mask occasionally will help with this as well. And then avoid contact with sick individual. So it's really important that if you're ill, you stay home to prevent infecting other people, and other people can avoid you to keep themselves healthy as well.
Why does this matter to the United States? Okay, so if this isn't another COVID-19, why should we care? Well, for one, HMPV is a reminder of how interconnected the world is when it comes to public health. What happens in one country can quickly make headlines globally, even if the risk to the rest of the world is minimal. For us in the U.S., it's a good opportunity to revisit some of the lessons we learned during the COVID-19 pandemic and the triple-demic of 2022, when RSV, flu, and COVID-19 hit us all at once. Remember that? Hospitals were overwhelmed, and shelves were wiped clean of flu medications like Tamiflu. While HMPV isn't likely to strain our healthcare system in the same way, it's still a reminder that respiratory viruses are a persistent challenge, especially during the colder months. It's also a wake-up call for why public health matters. So what should we do? Let's keep it simple. The precautions you take to protect yourself from the flu or COVID-19 are the same ones that work for HMPV. Wash your hands frequently. This is your first line of defense. Cover your mouth and nose. Use your elbow or a tissue when sneezing or coughing to avoid spreading droplets. Stay home if you're sick. Rest is crucial for recovery, and staying home helps prevent infecting others. Wear a mask in crowded places. This is especially helpful during flu season or if you're feeling unwell. Stay hydrated and get plenty of sleep. Your immune system works best when you take care of your body. These steps aren't just about HMPV, they're about staying healthy during any flu season. What's the bigger picture? Here's the takeaway. Yes, there's an uptick in HMPV cases in China, but it's not a cause for global alarm. The virus is seasonal, mild for most people, and not on the same level as COVID-19. For us in the U.S., the best thing we can do is stay informed, practice good hygiene, and avoid unnecessary panic. The media sometimes amplifies stories like this, but it's important to separate fact from fear. The World Health Organization isn't raising any red flags about HMPV, and public health experts agree that this is a manageable virus, not a global health crisis. Stay calm, stay safe, and remember, our best defense against any virus is the simple, everyday actions we take to protect ourselves and those around us.